Okay, here we go. We're talking about peptides, and the first peptide everybody always asks me about is BPC-157. What is it, and why should I take it? So the answer is BPC-157. BPC stands for Body Protective Compound. It's a naturally occurring peptide, which is a small chain of amino acids, so it's less than 50 amino acids. Amino acids are the building blocks of proteins, but also peptides. Peptides are signaling molecules. So it's a small, naturally occurring peptide that is derived from a protein that's found in the human stomach. And it plays a key role in tissue repair. It plays a role in inflammation control and cellular healing. So in functional medicine, it's used to accelerate healing, restore structural integrity in the body, but especially when recovery has stalled. So how does it work? Well, it supports the body's innate repair intelligence system. So it enhances angiogenesis, which is the formulation of new blood vessels. It signals damaged tissues to repair and regenerate. It modulates inflammation rather than suppressing it. Suppressing it is not a great idea most of the time, and that's kind of what we mostly do, all of us, right? We reach for the Advil bottle and for the Aleve or one of those things, and we decrease our inflammation, and just arbitrarily, we just don't care. We just don't want to have that inflammation because it sucks actually when your head hurts and things like that, but there's probably better ways to heal the body, and this is one of them. It supports gut lining integrity, and it works with the communication system between the gut and the brain. There's actually an axis of nerves that run between the gut and the brain. That's why when you hear things like, oh, I had a gut feeling, it's because the brain communicates with the GI system, and that makes us actually recognize that things might be happening. So that's one of the big ways that it works, and it works with improving collagen organization and tissue strength. So you want to think of BPC-157 as a repair signal, not as a stimulant or a hormone. It's not that at all. So what does it help with? Well, it helps with musculoskeletal healing, which is tendon issues, ligament issues. It helps with muscle tears. It helps with chronic strains, joint pain, overuse injury, post-surgical recovery. There actually was a human study, guys. That's kind of crazy because everybody says peptides are not tested on humans. That's not true. This one especially has quite a few human studies behind it. Most of them are not double-blinded, which is kind of the go for. Everybody wants a double-blinded study, and that's because that's the gold standard for drug therapies. But this is, they did a test with 148, I believe, people that had chronic osteoarthritis of the knee, and they were going to get knee surgery, and instead they injected BPC-157 directly into the joint, and 82% of them got better and were better a year later. That's pretty crazy. Gut and digestive repair. It works with leaky gut. It works with intestinal permeability. It helps with gastritis and ulcer-related damage. They're studying this now for gastric ulcers. They're studying it for ulcerative colitis, all sorts of stuff. Like, it works for inflammatory bowel conditions. It works for poor gut healing after antibiotics or illnesses. So you show me somebody that probably hasn't been on antibiotics in their life. It's not very many, right? Inflammation, nervous system support, reduces excessive inflammation signaling. It supports nerve cell repair and resilience, and it may improve pain signaling and recovery. I think this is a big one that no one's really talking about yet, although they are starting to look at BPC even in macular degeneration. But the fact that it heals the GI system and it makes the gut work better is also going to change the way that our body's neurotransmitters work in the system. And that's going to be a big deal. I think that we talk a lot about problems with people with serotonin reuptake inhibitors. And I think if we can heal the gut, maybe we don't need as many of those serotonin reuptake inhibitors, because look, let's face it, there's a lot of problems with those drugs. Performance and longevity support, faster recovery between training sessions. That's a big deal. Improve tissue resilience under stress, and it helps prevent re-injury by improving tissue quality. Another thing that nobody ever talks about. The tissue quality after you heal it is better with BPC than without it. Is it a steroid or a hormone? No, it is not. It does not shut down your natural hormone production. It works with the body's natural repair systems. It's a signal. It's not habit forming. It's not testosterone. It's not hormone replacement. It's not a steroid, guys. So how do I use it clinically? All right. I use this a lot in my clinics. We use it for chronic injuries that won't heal. We also use it for acute injury. Acute injury, it works unbelievable. We, in fact, had 4 guys over the age of 60 coming in after the national tournament for hockey. And of the 4 guys with hamstring injuries, 3 of them went back to play the next day after BPC-157. We also added TB500, which is Wolverine, but we're not talking about that right now. We'll talk about that another time. So it also works with gut dysfunction during systemic inflammation. It helps with recovery from surgery, repetitive stress. If you need recovery without hormonal disruption, this is your go-to, guys. It's most effective when combined with proper nutrition. Okay. If you don't have the foundation set, it doesn't matter how many of these peptides you put in. You got to set the foundation up. Proper nutrition, that's got to be number 1. Let's leave it at that. Gut repair strategies, hormone optimization when indicated. Really important to get the hormones under control, especially as you're getting older. Smart training and recovery planning. And here's some notes. Okay, BPC-157 is used off-label in clinical practice. There's no real indications yet. It's coming. I think in another month or so, we're going to have some really good indications, and we're starting to get some really good human data and some great studies. There was another study on interstitial cystitis, which is a kidney problem, which is amazing. I believe out of 142 people, all of them got better on BPC-157. That's insane. Quality dosing, delivery method matter. That's absolutely imperative. You need to have doing this under medical guidance. If you're not doing it under medical guidance and you're just sticking yourself and you're buying stuff off the line from China and some gray market weirdo thing, that's probably not a great idea. You have no idea what's in there. I'm not a huge fan of the FDA, but the reality is compounding pharmacies have some regulation, and we know that what you're getting is what they say they're giving you, and you're not going to have all this toxicity that might be in there that could be hurting you down the road. It's not a replacement for foundational health, guys. It absolutely is not. You have to do the foundational work first, but it does amplify that foundation. So the bottom line is BPC-157 heals the body when the body is broken. It helps with it. That's what it does. It supports repair, resilience, recovery, especially when the system's under stress or it's lost its ability to fully regenerate on its own. It's a signal, okay? So let's start looking at this as a possibility to help us when we have struggles. It's a really, really great tool.